Hi, my name is Jamie Lee. I work for the Collaborative for Maternal and Infant Health in the School of Medicine at UNC Chapel Hill. I'm going to speak with you about what we know about cannabis use during pregnancy and lactation. I primarily work on a tobacco cessation quality improvement project known as You Quit to Quit. But when I'm out providing trainings on tobacco cessation counseling, I often get many questions about cannabis use. So I've become familiar with the research on this topic. So to start, what is cannabis? Cannabis is the dried leaves and flowers from the cannabis sativa plant. You've probably heard of cannabis referred to as marijuana, pot, or weed. These are all common names for cannabis. Cannabis is the most commonly used illicit drug during pregnancy. Overall, an estimated 2 to 5% of pregnant people use cannabis during pregnancy. However, we see much higher rates of use within subpopulations, particularly younger, urban, and socioeconomically disadvantaged women. Cannabis can be consumed in many different ways. The dried flower of cannabis can be smoked using pipes or rolled into joints. Cannabis concentrates like oils and waxes can be vaped using vaping products or e-cigarettes. And cannabis can be ingested via edibles like candies or cookies, as well as oils and tinctures that can be added to foods or beverages. Cannabis contains many different types of cannabinoids. The one you're probably most familiar with is called tetrahydrocannabinol, or THC. And THC is the psychoactive ingredient in cannabis that's responsible for making people feel high when they consume cannabis. THC is a lipogenic molecule, meaning it is attracted to fats. And this quality of THC allows it to easily enter the brain, pass through the placenta, and accumulate in breast milk. I just want to make a note about THC, that there are different isomers of THC. The most common one, or the one that we are most familiar with, and what most people are referring to when they say THC, is called delta-9 THC. But you may have also heard of delta-8 THC. Delta-8 is a less potent isomer compared to delta-9, but it works in a similar way, so giving you those psychotropic effects. And delta-8 is currently legal to buy and sell in North Carolina. So I've seen these products for sale online as well as in gas stations. It is not quite as potent as delta-9, but it still produces some psychoactive effects. So that might be something that you want to screen for when you're asking patients if they use cannabis. They might not know necessarily that delta-8 is a type of cannabis product. In addition to THC, there are over 100 other cannabinoids present in the cannabis plant. One that you've likely heard of is cannabidiol, or CBD. THC has been the most studied cannabinoid at this time, but the impacts of all the other cannabinoids, including CBD, are not well understood. So one reason why THC and other cannabinoids do cause effects in our brains and bodies is because we all have an endogenous cannabinoid system. While it's not fully understood, the endocannabinoid system is thought to be important for maintaining homeostasis. The system is present throughout the body and is linked to many different functions, from appetite and digestion to muscle formation to stress. There's a long list there. It plays a big role, but really overall, maintaining homeostasis in the body. As part of the endocannabinoid system, there are cannabinoid receptors, mainly CB1 and CB2. CB1 receptors are found mostly in the central nervous system and the brain, while CB2 receptors are found in the periphery. THC mainly binds to CB1 receptors, but it can also bind to CB2 receptors. Our bodies also manufacture endogenous cannabinoids. Only 2 of these have really been studied in depth. One of them is called Anandamide, and it is an endogenous cannabinoid that is also known as the bliss molecule. And it's important to note that the endocannabinoid system starts to develop in the fetus around 14 to 19 weeks gestation. So I just want to compare anandamide, that endogenous cannabinoid, with THC that is found in the cannabis plant. As I said, anandamide is an endogenous cannabinoid that is involved in signaling. It binds to CB1 receptors in the brain and is tied to and the rest of the central nervous system. And it's tied to reward pathways, motivation, pleasure, feeding behavior, and the acute benefits of exercise. So if you've ever heard of the runner's high, that's anandamide at work. THC also binds to the CB1 receptors, but it's hundreds to thousands of times more potent than anandamide. So it's going to produce similar effects, but on a much higher magnitude. So those feelings of pleasure can be euphoric. There's the feeding behavior. So a lot of people, when they use cannabis, they'll get the munchies. So yeah, we're just seeing similar effects with an anandamide and THC, but THC at just a much greater magnitude. So when we're thinking about cannabis use during pregnancy, we want to remember a few different things. First, THC is lipogenic, which means it easily crosses the placenta and enters the fetal brain, binding to CB1 receptors there. The fetal brain contains more CB1 receptors than the adult brain, and these receptors are thought to play many important roles in development, particularly that of the nervous system. Due to its potency, THC has the potential to disrupt the roles of CB1 receptors in the fetus and impact this development. In animal models, fetal plasma levels of THC were about 10% of the maternal levels after acute exposure, but there are significantly higher fetal concentrations after repeated exposures. So we want to think of THC as cumulative, and that repeated use of cannabis is going to have a greater impact than just one-time use. As far as other cannabinoids, we really don't know much. CBD has become very popular in recent years, but little is known about its impact on fetal development. So we would say CBD should also be avoided during pregnancy. The guidance from the Academy of Obstetricians and Gynecologists is that research is limited on the harms of cannabis use for a pregnant woman and her fetus. Because all the possible harms are not fully known, ACOG recommends that women who are pregnant, planning to get pregnant, or breastfeeding not use cannabis. And I would love to be able to give you a definitive list of all the negative impacts of using cannabis during pregnancy. However, at this time, there are too many unknowns. Most studies looking at the impacts of cannabis to date have not adequately controlled for compounding factors, such as other substance use, primarily tobacco and alcohol, as well as socioeconomic conditions like poverty, malnutrition, and intimate partner violence that may be more prevalent in populations that regularly use cannabis. That being said, this is an infographic from ACOG highlighting some of the possible harms for both the fetus and the pregnant person, which may be helpful when counseling your patients to avoid cannabis. For the fetus, there is possible disruption of brain development, smaller size at birth, increased risk of stillbirth and preterm birth, and possible impacts on behavior and attention in childhood. For the woman, there is the risk of permanent lung injury or COPD from smoking cannabis, and increased risk of injuries due to dizziness that can be caused from consumption of cannabis, or impairment and reduced judgment or impaired judgment that can increase the risk of injuries. Cannabis should also be avoided during lactation. According to Thomas Hale's Medications in Mother's Milk, cannabis is considered lactation risk category L4. There's limited data and it's considered possibly hazardous. THC does transfer into the breast milk quite easily as it's a lipogenic molecule. Studies have shown that approximately 2.5% of the maternal dose is ingested by the infant via breast milk. We just don't know what the short and long-term impacts are for infants who are exposed to THC in breast milk. Cannabis may also lower prolactin levels, which could negatively impact milk supply. So that's something you may want to bring up with patients if the nursing relationship or feeding human milk is very important to them, explaining that using cannabis could reduce their milk supply and therefore make it harder to have a successful breastfeeding relationship. So overall, our conclusions for today are that cannabis should be discouraged during pregnancy and lactation. Cannabis has the potential to negatively impact fetal and infant development due to interactions with the endocannabinoid system. And pregnant people or those planning to become pregnant should be encouraged to stop using cannabis. If they were using it for medicinal purposes, they should switch to a medication for which there is better pregnancy-specific data. Thank you so much for joining us today. I hope this presentation was helpful. I'm sure that as cannabis is legalized in many states and able to be studied more, that we'll rapidly have more conclusive answers regarding the risks of cannabis in pregnancy and lactation. Thank you.